At any given point of time, there are multiple cells in our body that are dividing. Many times, these cells can transform into cancerous cell, but our body's immune system is smart enough to identify these abnormal cells and eliminate them. And one of the way our body does it by an activated immune system. So the immune system in our body will eliminate cancer cells. But if that is the case, why does one get cancer? That is because some of these cancer cells can acquire a unique property of hiding from body's immune system. They literally wear a biological mask because of which they become invisible to your body's immune system. Now, based on this, we have now developed an amazing new technique of treating cancer that is called immunotherapy. What immunotherapy does, it peels off the biological mask of the cancer cells, and the body's immune system can then eliminate the cancer cells. This is an amazing new drug that has literally cured hundreds, if not thousands of lives every week all over the world. This drug and this system of treatment of cancer is available with us, and we are very fortunate to say that we have really produced wonderful and amazing results for patients with different variety of cancers with immunotherapy. It has also come to my notice that there are a lot of other doctors all over the country and possibly all over the world that are touting different systems of treatment of cancer and are labeling it as immunotherapy. I must warn you of these because the real immunotherapy drug works wonders, whereas other drugs may not be able to produce that kind of result. Now, you may ask me, if immunotherapy is such a wonderful drug, then why is not everyone getting it? Because though immunotherapy is a wonderful drug, it does not work in all cancers. We have results for almost all major types of cancer, and it can work wonderfully well, but there are certain criteria that need to be met before you can say that the patient is able to respond to immunotherapy. And we have certain biomarkers which may predict the response to immunotherapy, but over the years what we have found is that many types of tumor that were incurable at one point in past have essentially become treatable, and many of them have also become curable. So now the question is, how do you know whether if someone you know is going through any cancer treatment or has been diagnosed with cancer, whether they can have immunotherapy or not have immunotherapy, whether that is the right drug for them? Now, to answer to that question, you will have to visit your nearest oncologist who understands how to use this therapy judiciously. Because even though we know that these drugs, they are relatively softer as compared to chemotherapy, they do have some toxicities and side effects. One of the main problems for so long with immunotherapy drugs has been the cost. Because these drugs were manufactured mostly by foreign companies, the drug cost in India was very high. Now we also have Indian manufacturers who have jumped into the manufacturing of this drug and has literally made it possible for us to offer it to majority of the patient. So if you think you or someone you know might benefit from having immunotherapy, you must refer them to the nearest oncologist, and you must discuss if this is the most suitable option for them.